na. So magandang gabi mga kababayan at welcome sa Pinoy Facebook Live. Alam niyo po, pasensya na kayo, medyo na-late, nagkaroon lang ng konting technical difficulties. Pero ganyan po talaga pag live, maraming nangyayari. So, ngayong gabi, Sunday, sabi po natin before, kapag nasa kabilang dako, lalo na pag sa US, we can actually adjust the schedule ng ating program from Saturday to Sunday. And tonight, we are actually very happy that our kababayan from San Francisco ay sinamahan tayo ng 8:00 ng gabi dito sa Pilipinas at ano oras ba? 4:00 diyan sa US. So, wag na po natin patagalin ang ating guest for tonight is actually a nurse. Maganda po yung kwento niya, yung trabaho niya from the previous one up to the current one. Our guest for tonight is a nurse currently based in San Francisco, USA, Miss Cecil Gozon Villasanta. Good evening and welcome sa ang Pinoy Facebook Live.
Hi, good evening. Good morning dito.
Good morning. Ano oras po ngayon dyan?
4:00 ng umaga, 4:23
Yeah, okay. So,
in the morning.
yan. So, yan sinasabi natin na napagbigyan tayo ng 8 o'clock. Kasi last time we also had a guest from San Francisco. She requested for an earlier time. Kaya maraming salamat sa sa paggising ng sobrang aga.
Yeah.
Kumusta? Kumusta ngayon na pandemic tapos you're a nurse? First time namin na makaka-interview ng nurse sa US at alam natin na ang case ng nurse sa US, ng case ng COVID sa US ay malaki. Kumusta?
So I don't provide direct patient care. What I do is I'm a nurse case manager sa hospital namin. What I do is I'm a discharge planner and also nag-aano kami ng we determine yung hospital medical necessity ng pasyente. Right now, ang unit namin I'm assigned sa COVID floor.
Oh.
So marami kaming pasyente na may mga COVID. So syempre maraming may sakit doon. Maraming ang mga COVID patients namin ngayon mas maraming may malala yung sakit nila.
When you say ng malala, what does it exactly mean? Tapos ano yung range normally ng affected na edad ng mga COVID patients?
Iba't ibang ages, mga 40s. Ang hospital kasi namin adult hospital eh. So ranges sa mga siguro 40s to 80s ganon. Tapos when I say malala, they require more oxygen.
Wow.
Yeah. Yeah. So mas marami kami ngayong may mga na pasyente na nagre-require more oxygen.
Wow. Mga
Yeah.
kababayan, actually tita ko si Tita Cecil. So, when I invited her, matagal ko na siyang gustong i-invite kasi nga alam natin na very challenging yung trabaho ng mga frontliners lalo na sa US. Tapos when you say tita ng malala, tapos nagulat ako na 40s. Do you have patients actually that is younger or who is younger than 40s? Kasi parang yung binigay mong range, yan ang sinasabi nilang normally mabilis maapektuhan ng COVID. Do you have patients who's actually below 40?
Seldom kami nagkakaroon ng mga younger. Although meron din kami mga naging pasyenteng as young as in their 20s ganon. Pero hindi naman sila nagkaroon talaga ng malalang sakit. Ayun.
Tapos siguro tita, bago tayo pumunta, pag-usapan natin ang husto yung diyan sa US mo. Kwentuhan mo kami ng kwento because gusto namin malaman, siguro lalo na yung mga kababayan. Nag-start po siya as a flight attendant, tita, tama ba?
Yes.
Sa Cathay Pacific. Ilang taon ka sa Cathay Pacific before you decided to transfer to the US?
So flight attendant ako for 16 years. I was based in Hong Kong. Tapos I enjoyed being a flight attendant noon. Tapos yung husband ko nag-join sa akin siguro last 5 years ako before I came here sa US. Tapos hindi na ako nag-enjoy ng pagiging flight attendant ko kasi I wanted to be with him. Tapos siya naman naging gusto niya makapunta rito sa US to live here. So ano siya yung he worked in a company na ang main headquarters was here in San Francisco. So they had an opening here sa San Francisco dun sa headquarters nila dito. And so he got a job here kaya siya ang nagdala sa amin dito. So
Ano,
everyone was thinking ako ang nagdala sa amin kasi ako ang nurse. Usually ganun ang case, 'di ba? Yeah.
tapos tita, curious lang siguro yung mga tao 'no, you're actually a nurse by logically or you graduated from UST as a nurse. How come that you initially chose to be a flight attendant and then later on, you chose to be a nurse again?
So I graduated sa Philippines sa UST. Siguro nag-work lang ako doon for 1 year. Tapos yung father ko didn't like yung schedule ko kasi I work there 2 p.m. to 10 to 11 p.m. So gabi na ako umuwi, madaling araw na ako nakakauwi. Tapos I would always tell him na marami akong nakakasabay na mga lasing sa jeep. Kaya sabi niya he didn't like it. So sabi niya, we have a cousin who worked for Cathay Pacific as a ground staff. So sabi niya, mag-apply ako doon. There was an opening for a flight attendant. So he and I went to meet him. Binigay namin yung resume ko. Tapos ayun, natanggap naman ako. Tapos yun nga 16 years ako nag-work. Tapos my husband joined me, yung husband ko joined me sa Hong Kong. And then yun na nga, tapos we went to we went to the US. Tapos sabi ko I'll take the nursing exams. Nakapasa naman ako. Ayun, tapos I think we went here 2007. I passed the exams in 2008.
Mhm. 14, so mga 14 years ka nang nasa US at kuwentuhan mo kami tita ng konti do'n because you said that you took an exam tapos pumasa ka doon. So, yun siguro yung mga tanong ng mga iba na kapag nurse ka na ba dito sa Pilipinas, can I actually practice my profession directly or should I, yung kaninang kagaya ng sinabi mo, mag-aaral pa ba sila ulit or mag-e-exams lang?
So before it wasn't so strict.
Hmm.
Now I'm hearing that meron na silang requirement that they have to study again.
Oh.
I can't remember if they have to study for 1 year. Unlike before, ako nag-take lang ako ng board exams. Tapos pwede na ako mag practice. Ngayon parang very strict sila sa mga galing ng ibang bansa. So mukhang nire-require na nila uli na mag-ano sila, mag mag-study here before they can actually practice. So I don't know exactly kung gaano sila katagal kailangan mag-exams. Pero dito pa naman marami talagang waitlisted na yung mga gustong mag-study ng nursing.
Oh.
Bago talaga sila makapasok sa nursing schools. I hear na matagal sila makapasok talaga sa nursing schools.
Yan ngayon, that's because of the new directive.
No, even before. Kasi even yung mga US citizens dito, even mga Americans, talagang talagang waitlisted.
Oh.
Yeah, for some reasons, talagang matagal matagal makapasok ng nursing.
Wow. So,
Yeah,
malaking bagay pala yun na nakapasok ka kaagad, you passed the board exam,
yeah.
you can practice. Gaano kadami ang Pinoy or Pinay na nurse sa grupo niyo or sa community niyo?
Oh my God. Ang dami yun, ang dami.
Wow.
I can't really tell. Madami.
So, good news yun kung maraming Pinoy na nandiyan ngayon at nagtatrabahong nurse.
Mhm.
Kasi nga ngayon, nakita ko rin na kapag mga frontliner sa US ngayon, I read that few weeks ago na talagang malaki ang naitutulong ng mga frontliners lalo na sa mga COVID patients kasi sila talaga yung masisipag magtrabaho.
Oo, marami pa ring Filipinos dito na who are more than willing to, to help yung mga patients, especially yung mga may sakit.
Hmm.
Marami ring I hear na marami talagang mga nurses din dito na mga nag nagkakasakit ng COVID.
Oh,
That's what I hear. Affected ng COVID, marami ring namamatay.
wow.
Um, Sabi nila out of the nursing mga Filipinos na nurses sabi nila parang sa population ng nurses, 30% of it are Filipinos. Tapos 4% of the 30% noon na nagkakaroon ng COVID. So
So,
maraming percentage ng Filipinos na nagkakaroon ng COVID.
ngayon na may vaccine na, last week or the other day may kausap din kami naman from Buffalo, New York.
Uh,
Sabi niya na nag-second dose na siya ng vaccine. I guess the time na we interviewed her, that was the schedule of her second dose. Kayo,
yeah.
nag-start na ba rin niya ng vaccination?
Yeah, ako nakapag-second vaccine na ako. So, um, marami ring side effects. So, yung first vaccine ko, okay naman ako, wala akong side effect, parang lang, hindi pa masakit, gano'n. Kasi maliit na needle yung ginamit nila, no? Pero yung second, masakit. So, marami among us, yung doctors, nurses, mga frontliners na nagre-report na nagkasakit, ako nagka-fever ako, nagka-arm pain ako that lasted maybe days. Yung iba, yung arm pain, yung meron silang namaga yung arms nila, yung armpits. Pero sabi nila parang mas effective daw, nagiging effective daw yun pagka nagkakaroon ka ng ganon. Pag namamaga daw.
Ang iba kasi yung ganyan din actually yung kwento ng guest namin last time na meron ngang
Yeah.
so, I guess, ang ginamit sa kanya was Moderna and, she
Mm.
said that, some of the frontliners talaga experience those things na na-mention mo like may fever. So,
Yeah.
normal pala yun.
Oo. Normal yon.
Mm.
Yeah.
But,
Kaya a lot of times, ina-advise doon sa amin sa hospital namin, you take your second vaccine tapos make sure you're on your day off the day after.
oh, para
Yeah,
para sure na in case na may maramdaman, they can actually rest, tama ba?
yeah, yeah.
So 14 years mo na nasa US kayo, tapos 16 years sa Hong Kong, tapos 14 years na nandiyan. Ah,
Mm.
ano yung mga challenges na naranasan niyo as Filipinos diyan sa US? Meron ba kayo nakaramdam ba kayo ng discrimination or wala naman?
Um, Dito kasi kasi we live actually here in Oakland, Oakland, California. So, fortunately dito mas diverse ang population. So mas maraming minorities dito. Mas maraming Latino, maraming Asians. So hindi talaga kami nakakaramdam ng discrimination. Like sa hospital namin, we have a lot of black people, mga Mexicans, mga Asians, different kinds of nationalities. So, hindi talaga kami nakakaramdam ng discrimination. So, unlike other states, tapos malapit pa ako sa Oakland, Chinatown. So, we don't really like avoid yung mga places na, we hear a lot of racial discrimination. So, hindi talaga kami nakakaramdam ng, alam mo yung mga reported na yung madaming Karen. I don't know if you've heard of yung mga Karens dito na talagang they will hurl like racial slurs at you. Wala naman kaming ganun pa, fortunately.
That's good news kasi tama na ang daming news na naririnig namin dito sa Pilipinas, especially for
Yeah.
the last few months na ang daming nangyayari. So,
Yeah.
mm,
Mas accepting dito sa San Francisco, sa Oakland, mas accepting dito which is very parang kaya dito we feel like mas maganda ditong magstay dito sa part ng California.
mm.
Yeah, kasi dito accepting sila ng yung mga gender, yung transgender, mga LGB,
Oo.
mga yeah.
That's so good news kasi, at least hindi nakakaramdam kayo na nandiyan ngayon ng mga gano'ng, situation sa US. Do'n sa
Yeah.
14 years na nandiyan ka, kailan ka nag-umpisa ng profession mo as a nurse? And, nung after the board exam, were you able to find a job immediately?
I did. So in 2007 is when I quit Cathay Pacific. Tapos immediately nag-review ako for 1 year ng for the board exams. Tapos 2008 is when I passed. Nako, alam mo ba, I applied sa 100 nursing facilities,
Wow.
hospitals and skilled nursing facilities alike. Out of those 100 applications, isa lang ang tumawag sa akin.
Wow.
And nakakatawa, isa lang ang sumagot, and yun pa yung skilled nursing facility that is just beside the apartment that we were renting.
Wow.
So walking distance lang talaga. So ayun, dun ako nakakuha. So talagang naglalakad lang ako going, and buti na lang kasi I wasn't driving back then. Ayun. So mababa ang sweldo kasi nursing facility, tapos syempre hindi naman talaga maganda ang ano doon. Hindi ka masyadong marami kang pasyente compared to when you work at a hospital. That's when I had my bedside nursing experience.
Wow. Kasi 'di bang nagiging notion nila na kapag
Yeah.
pupunta ka sa US, maganda rin na malaman ng iba na hindi gano'n kadali na 'pag pupunta ka sa US at nurse ka, eto na yung expect mo na magandang sweldo, malaking sweldo at parang mas madali, yung pala hindi.
Hindi, oo. Kasi, ang daming gastos. Hindi gano'n kadali. Akala mo 'pag nasa US ka na 'no, parang you hit the jackpot. Hindi, kasi ang daming gastos, like kasi yung bahay, yung tax at the end of the year yung magfa-file ka I mean the next year magfa-file ka ng tax, yung magugulat ka na you owe something, you have to pay, yung parang magugulat ka, eh. Especially here in California, mahal, eh. Mahal ang ang ano dito, buhay. Hindi ko pa hindi pa ako nakakatira sa ibang states, pero I heard na mas cheaper sa ibang states, but I wouldn't exchange, living here sa iba.
Wow!
Mm.
Nabanggit mo kanina na mahal diyan and everything na hindi gano'n kadali. Maraming mga dapat tingnan like yung expenses sa renta, sa lahat 'no? Ano
Oh,
naman
yeah.
yung pinakamagandang experience ng pagtira sa US? Out of those 14 years na 'no, ano yung pinaka masasabi mong this is actually one of the best?
Maraming advantages talaga to live here. Um, yung sinasabi nilang freedom of speech is true. Um, Kasi in the Philippines, medyo hindi ka when you work sa isang company sa Philippines, y- I work in the ano no sa UST hospital. Hindi I think I remember hindi ka pwede talagang magsalita sa sa leadership mo. In, I worked in Hong Kong for 16 years. Hindi ka basta nagsasalita against your leaders. You cannot really freely speak out. You cannot really speak your mind without any consequences. Ganon. Dito um, iba ang freedom dito eh. Iba. And ang women's rights dito really maganda ang they really empower you. They
Oh.
really empower you. Yeah. Tapos ang gusto ko rin dito are yung marami kasing mentally, may mga children, women, everyone who have mental disorders. Dito inaano sila, functional sila sa community.
Oh.
Functional sila sa community. Even at tsaka yung mga sa atin kasi 'di ba hindi sila may mga may mga Alzheimer's, dementia, yung mga with dementia. Meron ditong mga facilities who really take care of those people. Mga locked units, yeah. Sa atin sa Philippines wala talagang mga ganon. So, may mga sinasabi silang um, oh, kawawa naman yung mga matatanda sa US na nilalagay na lang basta sa pinababayaan sa facilities. Pero I think doon sila nakaka-receive talaga ng care sa mga ganong units, sa mga ganong facilities. So I think maganda yung dito, supported ng government dito yung mga ganong tao na kailangan ng care ng yung mga katulad mga mental disorders. Ayun.
Maganda tita yung sinabi mo 'no, kasi yun ang talagang naiisip ng iba na sa US, kunwari you reach like a certain age, dadalhin ka sa home
Mhm.
for the aged or sa isang
Yeah.
facilities. Tapos you mentioned na doon kahit na nasa facilities talaga well taken cared of lahat ng nandoon.
Yeah, yeah. Marami kaming pasyente dito na you would be surprised at in their 80s, 90s, they still live alone.
Oh.
Yeah, they still live alone. They're so independent. They're so independent. Sa Philippines, parang you seldom see them living alone. Marami tayong pamilya. They live with them. Parang parating physically they need assistance. Dito, they live alone. Yung parang talagang, kaya sabi ko nga, empowered ang tao dito eh. So, maganda ang dito, support.
Na-mention mo yung 80s to 90s and they live alone. Ah,
Yeah.
siguro a few weeks ago, I was talking to someone, ang sabi ko, I just noticed sa US, kasi marami rin ako nakita nung last time na even like at a certain age, ang lalakas talaga
Mhm.
nila.
Malalakas, yeah.
Sa tingin niyo, ano ang factors na nakakatulong sa paglakas nila? Kasi dito sa Pilipinas, 'pag nasa Metro Manila ka, yung age na yun is bibihira, but 'pag nasa probinsya ka, you may probably reach that certain age.
So, I think yung, um, environment mo, yung healthy yung air,
Hmm.
yung pollution, kasi sa Pilipinas lang marami ng pollution diyan, eh. Yung preventive care, we don't have insurance there kaya hindi talaga nagpapatingin ng tao diyan sa ng regularly. Unlike dito, it's in people are encouraged to see their doctors regularly para, to make sure that you are healthy. And at certain ages, there are may mga exams like for women, for men over 50s, you have to have prostate exams. For women over 40s, you have to have certain exams na kailangan ginagawa mo to make sure that you are healthy. Sa Philippines, walang preventive care. So, is unlike sa atin, marami akong workers din sa co-workers sa Hong Kong who are na sadly namamatay of cancer kasi hindi rin ini-encourage o na magpa-check up. So namamatay na lang bigla of cancer kasi all of a sudden bigla na lang nagkakasakit. Kasi we don't really go to our doctors. I mean, when was the last time you saw a doctor, right? To
Ay,
have yourself checked.
totoo.
So,
And actually,
kaya marami talagang dito na nagpapa-check up.
so fully supported talaga ng government nila.
Yeah, yeah. Kasi we have insurances here.
Okay, that's actually a
Mhm.
very good one. Sa tingin ko malaking factor 'yon na merong preventive check-up,
Oh
every
yeah, definitely. Definitely. That's one thing, the importance sa isang health ng isang tao.
nabanggit mo yung, kung papaano yung kultura na meron sa Hong Kong in 16 years na nag-stay ka doon, tapos yung dito sa US, masasabi mo rin ba na kahit papaano conservative pa din ang mga Chinese or yung mga Hong Kongers? Based din sa
Oo. Yeah, yeah. Mas conservative din talaga sila. Iba, they talagang minsan nagugulat sila sa mga dito 'pag nagkukuwento ako about yung mga Hong Kong experiences ko, they're shocked doon sa mga kwento ko na parang, "No, no, that didn't happen." May mga gano'n. Kasi, sa Hong Kong kasi black and white, eh, there's no gray area. There's
oh,
no gray area, yeah.
so dalawa
Hindi ano, hindi sila ang Hong Kong hindi accepting of, certain behaviors.
wow, so very ano talaga, limited and traditional. Anong nami-miss mo sa Pilipinas?
Ang nami-miss ko sa Pilipinas is yung, um, I think yung Christmas, yung yung mga gatherings, gano'n. Kasi like kami dito sa US and when we were in Hong Kong, kami lang parating apat ng asawa ko tsaka nung dalawang bata. Hindi kami talaga pumupunta sa mga wala kaming ibang relatives dito, eh, wala kaming family. So, ang mga anak ko hindi nakaka-experience ng yung mga get together, walang gano'n. Walang yung mga grand, reunions, walang gano'n. So, yun ang nami-miss ko ngayon.
May balak pa kayong umuwi sa Pilipinas? Or, eto lagi namin tinatanong, eh, kung may balak pa ba na umuwi sa Pilipinas or bakasyon lang talaga ang parang mangyayari sa Pilipinas?
Yeah, yeah, gusto kong nung una, ayoko sana pero my husband has this, great idea na 'pag nag-retire kami, maybe para tumagal yung retirement money mo 'no, is to siguro spend, half of the year sa Manila, half of the year dito. Yun, kasi siyempre may maintenance medication ka na that you won't be able to get sa Pilipinas or tapos kailangan mo ng regular checkup, punta ka dito sa US to see your physician, yung mga gano'n. Ayun, so yun ang ano ko. Kasi, um, one of the benefits I get sa Cathay Pacific until now is yung lifetime travel benefits. Now, hopefully, I would still get until after I retire from here. Um, so I still have travel benefits sa Cathay Pacific until now. So hopefully until I retire, meron kaming travel benefits. I get like 90% discount. Yeah. So sana tumagal 'yon para magamit namin yung travel benefits na 'yon when we travel.
Wow. Actually, ikaw ang isa siguro sa may parang yung mga dream professions ng ibang mga lalo na yung mga ladies 'no, FA at saka nurse.
Yeah,
Oo,
yeah.
'di ba, you actually, you didn't practice immediately your profession as a nurse kasi
Mhm.
FA is a very prestigious sa mga ibang babae and then after nun naging nurse ka. Anong ma-advice mo doon sa mga tao na talagang ang dream nila is to be a flight attendant or probably those who wish to go to the US as a nurse?
It's so funny kasi it wasn't actually my dream to become a flight attendant or to be a nurse. Kasi
Oh!
yeah, kasi when I was young, I didn't really know um, what I wanted to become. So, masunurin akong bata eh. So, I just, kasi when you're younger, nakikita mo kung sinong model mo, you wanted to I wanted to follow what my sister kasi ang father ko was a banker. He worked in a like he worked in a bank. Tapos yung most of my siblings worked in banks as well. So gusto ko sa banko rin mag-work. So gusto ko ang kunin ko I can't remember what I wanted to take but more sa doon sa trajectory na yun, doon sa mga bangko sa bangko ang gusto ko sa trabahong yun. And so that's what nag-apply ako sa UST ng nursing tsaka doon. Um, and then sabi ng mama ko, mag-nursing ka din. And then yung nursing ko sa exams ang unang lumabas, nursing application ko unang lumabas. So my mama said, mag-apply ka na, mag-enroll ka na. So nag-enroll na ako. And then, yeah, so lumabas na pumasa rin ako doon sa isang course doon sa UST. Like, pumasa na rin ako doon. Mag-enroll na lang ako doon. So nasabi ng mama ko, no, gusto ko mag-nursing ka. So sabi ko, sige na nga, mag-nursing na lang ako. Ayun, so nag-nursing ako and then naging flight attendant ako because of yung papa ko dahil sa hindi niya nagustuhan yung schedule ko sa nursing. My advice actually is nakakatawa sabi ko do sa mga anak ko is minsan talagang you just have to follow what your parents ask you to do because they know better. Like kasi like I have lifetime travel benefits because of my mom, because of finalo ko ang advice nila. And now I may have, you know, pagkatapos ko kasi dito, here, like I work in a hospital, in a public hospital. After I work for 20 years, I may have lifetime medical benefits.
Wow!
Yeah. So may mga certain benefits that come with working sa mga hospitals. So like for me, uh after I retire, I will have medical benefits. So pati yung mga anak ko magkakaroon ng mga ganun, yung asawa ko magkakaroon ng medical benefits. So my advice is to actually listen to your parents as well. May mga may mga good advice din ng mga parents mo. Hindi mo alam, 'di ba? Minsan kahit i-push mo yung gusto mo, hindi naman talaga practical. hindi it doesn't work out really if you push it.
Maganda yung sinabi mo na listen to your parents kasi mas nakikita nila minsan kung ano yung pupuwede at mas maganda
Yeah,
para sa'yo.
yeah,
Malaking bagay yung sinabi mo na yung benefits. I guess a lot of people actually the reason why they wanted to work sa mga airlines ay para sa libreng libreng trips.
yeah. Mahirap din ang ano ha, mahirap din ang pagiging flight attendant. Like, kasi you're away from your family. You're especially when you get married after you become a flight attendant, you're not really with your family. You're always away from your family. You may bring them, yeah. Tapos maganda kasama mo sila, when you travel, you may wanna bring them sa flights mo, ganon. Pero it's not as easy as others may think. Pero, it, others may find it nice. Pero personally sa akin, it wasn't really, I was lonely dahil, I'm one person who really would love to see my family every day. So like ngayon, mas happy ako dahil I get to see my family every night. So yung iba naman, after I hear na may mga coworkers ako who were flight attendants before, and when they, I think when they left Cathay Pacific and, you know, naghiwalay sila ng husbands nila because hindi naman pala talaga sila compatible, yung mga ganon. So, it really depends on you.
What's the best thing about being a flight attendant and being a nurse?
Being a flight attendant, I think talagang you will cherish it kung alam mo yung it's when you are talagang maganda rin pag nag-travel ka, no? When you go to different countries, ma-appreciate mo yun kung you're into history. Hindi yung you're just into shopping, you're into kung kung alam mo yung history mo, no? Kasi ako parang, oh wow, nandito ako sa America, nandito ako sa ano. Pero kung kunwari nasa Paris ka and you know the histories of these places na pinupuntahan mo, I think you'll appreciate them more. Um, Tapos, yun ang talagang magandang experience sa akin. There are, I think you would love it kung mahilig kang makipag-socialize sa ibang tao. I think one of the good experiences that came from it was medyo hindi naman talaga ako sociable na tao, ano. But I think I learned from it kasi iba't ibang nationality ang naka nakilala ko sa Cathay Pacific. Um, so like here, nagkaroon ako ng confidence doon sa Cathay Pacific talking to different people. Ayun. So here, sinasabi nila, why do I act differently from other Filipinos? I don't know why, pero parati ko naririnig yan dito na how come you're different from other Filipinos dito? I don't know why. I guess because may mga nakuha rin siguro akong ugali na when I was in Hong Kong. Tapos as a nurse, nagkakaroon ka ng compassion, nagkakaroon ka ng um, iba, iba when you have to deal with these people who are there, not just people who are sick, but those people who are visiting them dahil may sakit. So, as a case, kasi nurse case manager nga ako, no? So, you're dealing with people who are sick or people or families na you have to be able to understand their situation. Kasi what I do is I also help them navigate yung healthcare. I also call the insurances and advocate for them. And one of the duties I have is to tell the families that they have to pay for certain items,
Wow.
like a hospital bed. Or sometimes I have to tell them, if you don't leave the hospital, they may have to pay on the day that they don't leave.
That's
Because
very tough
they're not.
job.
Yeah, imagine if they don't feel well, but the insurances say, well, you're supposed to leave today because according to this, criteria, you don't meet the hospital criteria anymore. So it's a tough job to tell someone who feels sick, and yet the insurance says, well, you're no longer sick. So that's a tough job to tell someone na who's in the hospital, and they, of course, they won't understand it. Like, how come this is me? I'm the one who's sick. How can you say that I'm not sick? Di ba? So that's something that I have to deal with, like, every day.
Wow. It takes a lot of, courage and compassion, lahat ata ng
Yeah.
pupunin eh.
Yeah. So kailangan mong gawing trabaho mo. So ikaw yung evil doon sa ano minsan, 'di ba? So you have to advocate din for them. So makikipag-away ka rin sa mga insurance case managers kasi sasabihin mo na, well, they're not really doing well. You have to justify why they have to stay longer.
Wow. And
Yeah.
salute you for that because I know it's a tough job, especially iba
Yeah.
ang yung regular situation na nasa labas or nasa opisina at iba rin kapag nasa hospital.
Oh yeah, definitely. Definitely. Yeah.
Mabilis ang oras talaga 'pag, marami pa akong natutunan sa'yo ngayon. But,
Yeah.
my last question would be or ang hihingin ko na lang is advice dun sa mga Pilipino na alam niyo naman 'pag sinabi talaga na US, marami ang gustong pumunta at mag-migrate diyan sa US. Anong advice niyo sa mga Pilipino at, your message also to, of course, lahat ng relatives na nasa Pilipinas?
It's not really possible to just, yeah, you want to go to the US. It's not, I don't know exactly how you would, yeah, you have a dream to go to the US. I don't know how you would come here. If you have a way, I think advice ko is uh to make sure na when you come here, uh alam mo, gahanap ka ng trabaho. I can't really say maraming magsasabi sa'yo kung anong available diyan na trabaho, kunin mo. I'm not agreeable to that idea, really, to be honest with you. But kung yun ang, it depends really on what your educational background is. Pero naniniwala ako kung masipag ka and kaya mo ang marunong ka sa pera, magiging madali ang buhay mo dito. Hindi ka magiging, I think magiging maginhawa ang buhay mo dito. I don't know what to advise sa mga tao sa Pilipinas, how to get here, because really there's no easy way to get to the US. There's no easy way. Unless, of course, you have relatives here. I mean, if there is an easy way, I would, you know, anyone could just come here. Di ba? There's hindi ganun kadali.
Oo, ayun maganda
Yeah.
yun. Hindi gano'n kadali at hindi rin ganyan kadali ang buhay sa US.
Yeah. 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 Anyone would just be able to come here if it was that easy.
So yun, thank you so much, thank you at
Yeah.
pasensya
Salamat
sa
din.
pagpupuyat kasi alam namin na you have to wake up super early just for us, just of course to be with us tonight. Ah,
Yeah.
Ang co-host ko po ay supposedly kasama ko si Miss Jenna, but she's actually sick. So she said,
Yeah,
I cannot join. So thank you so much ulit at maraming
salamat
salamat.
din.
Stay safe, stay safe.
Ikaw din.
Maraming salamat. Mga kababayan, marami po tayong natutunan today from, FA job, tapos nurse sa US. So this is actually the first time. Our guest for next week is again from the US. Dati po rin siyang nurse, pero ngayon ay meron na siyang organic farm. So we will hear something about her story naman next week. So maraming maraming salamat ulit at huwag niyo pong kalimutan bisitahin ang aming portal. It's at www.angpinoy.net. This will also be uploaded in YouTube. It's called Ang Pinoy Channel. So bisitahin niyo rin po at maraming salamat. Thank you! Magandang
Bye.
gabi. Bye-bye!